All right, we are definitely live now. So I gotta be honest with you guys. I just did this whole webinar to myself in the preview screen because I forgot to hit go live. So um, first one's a charm, right? Okay, so here we are. We're live now. I see all the red. We're letting people log in and we're rocking and rolling now. Sorry about being late. But again, I just recorded this whole webinar to my own personal computer and not sharing it with the world. So here we are. I am Dr. Victoria. I am new with this Facebook Live thing, so give me a just, let that one slide. I am a chiropractor here at Tree of Life Chiropractic, where we specialize in pediatrics, prenatal, and all things family. And really, the reason why we're going to start doing these webinars is because we like to provide more information and education on different topics that we are certainly passionate about and that we see a lot of in our practice. We believe that an educated parent is an empowered parent, and the more information that you have to make decisions about your child's health, the more you'll rest easy knowing that you made the best possible decision you could for that kid. So after watching this webinar, if you guys have any questions, please don't hesitate to ask. And if you think of anyone else in your life that might need this information, please don't hesitate to share it with them. We would love that. So ear infections. Tonight we're going to be diving into a couple different things. We're going to talk about what causes ear infections, also why ear infections keep reoccurring in some kids and not in other kids. We're going to talk about why antibiotics work some of the time, but not all the time. Also, why ear tubes are not always a good idea for treating ear infections. And then also, we're going to talk about a more natural approach to healing in the body through our chiropractic care. So let's just talk about a couple of common things about ear infections. Ear infections are actually the most common reason kids are taken to the emergency room. And just because they're very common in children does not make them normal and does not mean that they're supposed to be happening in children. So we talk about that issue a lot here, common versus normal and what's okay and what's not okay. But, you know, ear infections, our bodies were designed to be healthy. So especially a kid's body, they don't have as much going on as adults do. So it makes sense that they should be healthy all the time and vibrant and loving life and not having all these ailments and issues that we're seeing today. So the other thing about ear infections is that they're actually the most common reason why antibiotics are prescribed to kids. And we're going to talk a lot about antibiotics too here in a minute. And then also, a common myth about ear infections and what causes them is that ear infections happen in kids because their eustachian tubes are horizontal. So if you think about that for a minute, that doesn't, you know, the bodies are probably designed this way for a reason. Our bodies are designed very amazingly, you know, and so everything happens for a reason in the body, and it was designed a certain way. And I don't think the fact that the eustachian tubes are horizontal is the reason why kids get ear infections and adults don't. So what I think ear infections are really caused by is ear infections are more of a plumbing issue and more of an immune system issue. So it's not because the tubes are horizontal, because that implies that things move through your body using gravity. And that doesn't really make sense if you think about it. I have blood in my feet right now, but it's not because of gravity. It's because my heart is pumping the blood, you know, throughout my entire body and especially to my feet. When you eat your food, it doesn't just slide down your, you know, esophagus and into your stomach and out your colon and all that stuff through gravity. It uses smooth muscle to pump that food through the esophagus, stomach, and colon, and etc. So the ear tube actually works the same way. There's a tiny muscle in the ear shaped like a donut, and it's called the tensor veli palatini. It's a very fun Italian, well, it's actually Latin, but it's a fun muscle to say. We're going to shorten it to TVP for short, just so that I don't trip over those words. And yeah, okay, so that TVP muscle is a donut-shaped, tiny little muscle, and it goes at the top of your neck. It is secured to that bone, which is the atlas, the very top of your neck. It's also secured to the palate, and it surrounds that eustachian tube. So very small little muscle, but every time the child moves their mouth, through talking, through suckling, through chewing, it is pumping, you know, kind of like that. So, but what happens if that misalignment at the top of the neck is there? Things are shifted out of place. Well, now that muscle doesn't pump anymore. It actually becomes a dam, which, the canal is there. If that dam is there, that fluid gets trapped because it can't move past it. It needs that constant pumping mechanism in the ear to actually push that fluid through. So once that gets dammed, it holds that fluid there behind the eardrum, which it can actually lead to a cesspool of breeding ground of different viruses and bacteria and stuff that can be up in there. If you think about a puddle of water or a kiddie pool that you leave and it's stagnant and there's you leave that water there for days, and it can definitely be a breeding ground for different molds and stuff like that. So the ear canal works the same way. If we let that fluid sit back there and it's not being moved because that muscle is not working the way it's supposed to, well, then that's going to lead to ear infections. So how would these misalignments even happen in a kid? Well, birth trauma is a huge reason why they'll happen, especially in babies when they haven't had a lot of other issues that have come up yet. If the kid's a toddler, I'd say birth trauma could definitely still be a factor. Slips and falls could be another factor. And then other things that can cause stress on the child's spine and nervous system, causing those misalignments. And those misalignments cause stress on that TVP muscle, which can actually tighten it. So if that, think about a bone in your back being misaligned. That's going to cause all those muscles around it to feel tight. It's the same thing in the ear. If that bone at the very top of your spine is misaligned, that muscle is going to become very tight, and it's not going to help that fluid drain. So, let's see, where was I? Lost my train of thought. Sorry. Okay, ear infections are also an immune system issue. So if you think about that, again, at the very top of your spine, we have a very important bone here, the atlas, and surrounding inside the atlas is the brainstem. So at the top of the neck, that bone doesn't just surround muscles, it also surrounds the brainstem. If you know anything about the brainstem, it's like ground zero for the fight or flight response. A fun fact about the fight or flight response is that when it is engaged, it's not just a stress response and an emotional thing, it's also an immune system issue, because that fight or flight mechanism basically signals your immune system to stop doing what it's doing, because we need a fight or flight. We need to run from a bear, whatever it is that you're supposed to defend your body from. So that actually acts as, it shuts off that immune system. So if that muscle's, that bone's misaligned, it affects the nerves, going to your stomach, all this stuff. It jacks up the plumbing, it jacks up the immune system, and it jacks up the neurological function of that area. Which is where we step in, and this is what is so cool about what we do. We use technology to check to see if your child has those nerve interferences and those misalignments in their spine. We can use this technology on a baby, we can use it on a pregnant woman, a child, anyone, any age it's safe for, and it's non-invasive, it doesn't hurt, and it gives us a lot of information to tell us if chiropractic is going to be a good fit for you or your child or anyone else. And with very gentle, specific, neurologically focused adjustments, we can radically shift that plumbing issue and radically uplift the immune system so that your child has a chance to heal naturally without the use of antibiotics. So let's talk a little bit about antibiotics now. Pediatricians agree that antibiotics are not necessarily a good thing to continuously keep prescribing, especially when they're unnecessary. And for ear infections, your body should be able to heal from naturally without antibiotics. So to constantly be prescribing them for an antibiotic for an ear infection doesn't really make sense, especially when most ear infections that happen in the body are actually viral in nature. And if you know anything about antibiotics, they work on bacteria, not virus. So therefore, using them for a viral ear infection is just it's not gonna help the ear infection. It's just gonna wipe out all the bacteria that you have in your system. And I'm not anti-medication. I'm not saying this because I wanna bash antibiotics. I'm just saying this because, the antibiotics are great when you need them, but they should be used accordingly, right? So if that ear infection is viral in nature, then they don't need the antibiotics. You can definitely get that tested, you know, to see if it's bacterial, because 20% of them are, right? So in that case, it would help. That's why you see some kids actually get rid of the ear infection using antibiotics and some don't. But again, it's very small. So the other big issue with antibiotics, though, that we should touch on is that antibiotics wipe out all the bacteria in the gut. So the good bacteria, the bad bacteria, it just wipes that slate clean. And if you know anything about where the immune system lives and why the gut is so important, I mean, that's a huge craze now, right? Probiotics, prebiotics, everybody's all about the gut health now, because the immune system, 70+% of the immune system is housed in your gut. So if you're wiping the slate clean with good, bad bacteria, you're going to have a really hard time with your immune system. Things aren't going to be working the way they're supposed to, because you need the bacteria in your gut to actually be able to work the way it's supposed to. The other thing about antibiotic use is that it has also been correlated, you know, repeated antibiotic use has been correlated with asthma. So 7 times more likely to have asthma if you've used repeated antibiotics. So just a little side note to keep in mind there. Again, not my 2 cents. This is actual research here. So when multiple rounds of antibiotics don't work for these kiddos, what's the next step? Usually the next step is tubes. So tubes are actually the most common surgery that kids undergo. And it's a pretty traumatic surgery. It can leave lasting effects. We'll talk about that in a minute, but it's important to note that the tubes themselves don't actually heal the body of the ear infections. The tubes themselves don't actually prevent the ear infections from occurring. I've had kids come in and they have had multiple rounds of tubes, multiple rounds of antibiotics, and they're still getting ear infections. So what's that about? The tubes work to drain that infection. So you imagine your eardrum, you know, drum, and you puncture it with a tube. So what that does is it acts like a vacuum. It sucks all that fluid in the body, not out the body. Remember, that's a breeding ground of bacteria and fungus and stuff. We don't want that stuff in the body. But what that vacuum does is it sucks it in. And where does it go? It drains it out of the ear, that's for sure. But guess where it goes? It goes right down here to the next catch-all, which is the tonsils and the adenoids. And when the tonsils and the adenoids get overwhelmed from all this fluid that's coming from the ear, they get inflamed and they become overwhelmed, which can lead to the next most common surgery in kids, which is a tonsillectomy. So you overwhelm, you know, the adenoids and the tonsils, and then we remove those because they're all inflamed and the kid can't get his stuff under control. So let's take those out of the picture. That's the next thing that will happen. And then after that happens, this can lead to the next catch-all, which is in the lungs. So after the tonsils are removed, the fluid will drain down even more, and that will go deeper into the lungs. This can lead to just pneumonia, croup, and asthma, and other respiratory tract infections too. This is why tubes don't always work, and sometimes they actually make things worse for these kiddos. Tubes, another thing to note, is that they lead to scar tissue development. Because you're inserting a foreign object into your body's going to build up a bunch of scar tissue in that area to push it out, which is actually a really common thing that happens when kids get tubes, is those tubes fall out. Those tubes fall out because the body is designed to heal itself, so they're trying to repair that area and push that out so that they can close up that hole. Over time, that scar tissue that builds up there can actually lead to hearing loss. And if those kids are still developing, like, you know, the toddler age where they're learning how to use their speech properly, they're pronouncing words the right way, all that stuff, if they're still developing and they can't hear out of one ear, their speech is going to be challenged. They're not going to be able to hear what they're saying to communicate effectively enough, and they might have, you know, just different speech issues, like not being able to pronunciate their words correctly. And if hearing and speech is challenged, this can lead to other neurodevelopmental challenges down the line too. And so I think we can all agree that it's not just a simple routine ear infection, and they're not normal for kids to experience. It's a much bigger issue than that. It's actually becoming a childhood epidemic because so many kids have ear infections, and then, you know, all these traditional means of dealing with those ear infections lead to all these other issues down the line. So when it comes to your child's health, we really don't like to guess. We always test. which is why we use that state-of-the-art technology that I was talking about before, which shows us if your child has these misalignments in their spine. It shows us how bad that nerve irritation is in their spine, and it can also help us to better determine if chiropractic is going to be a good fit for them. It will also help us, tailor our adjustments specifically to each child, making sure that they're getting exactly what they need for their body and their nervous system to start working the way it was intended to. So again, if you found this video helpful, please share. And if you have any questions, you should. I mean, I talked about a lot of stuff that you might not have heard before. So please don't hesitate to ask, share them in the comments below, send us a direct message, give us a call, whatever you need to do to get your questions answered. I really appreciate you guys tuning in, and I hope you all have a wonderful night. And I don't know what our next webinar is going to be about yet, but we'll post about that soon. Have a great night.